is our time to actually do something, and we're going to take advantage of it. So I want to bring Ingrid Cochran in here now to talk about one aspect of this, which is the extreme structural inequity and structural racism that we have in this country. And I think that more people are getting a better understanding of as time goes on. I think it's been a huge awakening. And I think that that we are doing what we can to keep that momentum going, because we don't think this is something that should drop. So Ingrid, if you could talk a little bit about what the relationship is between ACEs, racism, and inequity, I think that we'd be pleased to hear that.
Thank you, Jane. I think that there's so much to unpack when we look at the intersection of race or racism and ACEs. So we already know that there's a lot of research to support that people of color, and I'm speaking specifically about Indigenous people, African Americans, and the Latinx community, are experiencing more complex trauma. And I remember when I first started in collective impact around ACEs, so much of the rhetoric was, this is kind of the great equalizer. When we're looking at trauma, all groups of people are experiencing trauma. And even when I first started, we were a part of a movement that really wanted to look at messaging. And we worked with the Frameworks Institute to come up with messaging that would be, that would get the most support from the public. And often it was the message of all children, all communities. And that's a great message. And I don't think we should take away from it, but we cannot ignore that some communities are experiencing more complex trauma. Some communities are experiencing racial trauma. Some communities are experiencing or have been experiencing historical trauma through centuries. And that this has created a chasm of a lot of issues. So obviously we know that when we experience high levels of stress and trauma, that it has an impact on our brain's functioning. And we also know that this leads to issues of mental illness, stress, depression, anxiety. But then on the next level, when we think about the systems approach, then it leads to communities, neighborhoods being more likely to experience violence. It leads to lack of access to care. It leads to a lot of different issues that are going to be exacerbated when we add in another layer of the color of skin. And this issue has been looked at in a totally perverse manner up until this point. One of the ways that I was able to really conceptualize the lack of understanding when it comes to racism, at least here in America, was my work in the medical field. So as I interact with pediatricians and doctors who are looking to be trauma-informed and work on health equity, the fact that they're still stuck in this idea of genetic race was one of the issues that was hard to get around. The belief that African Americans are predisposed to issues of diabetes and high blood pressure, as opposed to the understanding that the hostile environment of racism is creating chronic stress-related diseases within certain communities. And this is a complete shift in our understanding of the world, because so much of the stress and trauma that is experienced in communities of color is due to racism. It's due to how the mainstream society sees them, the beliefs and values that we have around people of color, the economic exploitation of people of color, the redlining and the creation of dangerous neighborhoods that are specific to people of color, the way that we demonize parents of color who are attempting to raise their children in a way to embed them within a racist society that's survival focused, that's built on the parenting practices of that have weathered through genocide and slavery. We totally view these issues as lifestyle issues, as issue of culture, without acknowledging so much stress and trauma, anxiety that comes along with having darker skin in our society. We act as though that these issues just happen in a vacuum, that we believe the understanding that certain groups are more likely to be criminal based on skin color. Certain groups are more likely to be sick based on skin color, even though, again, we do not have a genetic race. This means that as we take this understanding of ACEs science and the understanding that we have about epigenetics and generational transmission of trauma, now we have to understand that, you know, there is a chicken and egg situation here. And so racism is the chicken, it's first. And that has created all of the different issues of disparity and inequity. And that largely these disparities and inequities are rooted deeply in greed and the way that our system is set up to economically exploit people of color, either for land or for free labor. And that this has effectively traumatized large groups of people over hundreds of years. And that is the reason why we have such disparities and inequities that are impacting certain communities over others. And so I hope that as we move forward, especially with the information that we're getting from the data around COVID-19, that we can shift this perspective, that we can shift it from, well, people of color, specifically indigenous, Latinx and African Americans are more impacted by COVID-19 because they have poor health, or because they are more likely to be living in poverty. So then what's the next level? Well, why do certain groups have poor health? Why are certain groups more likely to live in poverty? We have been told the historical story that these groups are deficient and less than based on their genetics, based on the color of their skin. And this is just not true. And hopefully we can move forward with a different perspective on these disparities.